Everyone. I'm Joyce Fillenwarth. I'm the State Office Rural Health Manager. And our next topic I know is of interest to everyone. Workforce recruitment and retention is just the number one hot topic from the impact that we've seen from COVID. So I'm just so excited today that Lacy Foy, our primary care manager, is able to come and speak to you on the tools for recruitment and retention that are available to you under the loan repayment programs. So just to share a little bit with you about Lacy, she graduated from Indiana University, and she's been working on healthcare workforce related initiatives for 6 years, and she is so passionate about addressing rural health disparities. Lacy works closely with the Bureau of Health Workforce at HRSA on numerous work groups related to the designations of health professional shortage areas, technical aspects of the shortage designation management system, and the National Health Service Corp site education initiatives. So it's my pleasure to introduce to you Lacy Foy. And Lacy, I'll turn it over to you at this time.
Thank you, Joyce. I am very excited to present to you today and talk about health workforce recruitment and retention. I know that has been on everyone's minds recently, and it's been very overwhelming. I know for our office, hearing everyone talk about increasing workforce shortages and the great resignation that we're going through. So I hope that I am able to help shed some light on how recruitment and retention works through utilizing health professional shortage area designations, National Health Service Corps, Nurse Corps, and the State Loan Repayment Program. Our mission at the Indiana Department of Health is to promote, protect, and improve the health and safety of all Hoosiers. Our vision is every Hoosier reaches optimal health regardless of where they live, learn, work, or play. So first, we're going to talk about the basis of all recruitment and retention programs through the federal government, especially at HRSA, and that is health professional shortage area designations. In order to qualify for many of the recruitment and retention programs and other incentives, you must be located in a health professional shortage area. On the screen now, I have primary care shortage areas, mental health shortage areas, and dental health shortage areas. We really do need to do some work on the primary care shortage area designations. As you can see, we do have counties that are in white, which do not have a designation. Those counties we are currently working on looking at if they qualify for a designation. Mental health, we still have a couple counties left that we're working on getting designated. Vigo and Clay County currently are under review, as well as Stark. So hopefully we'll have those counties designated as mental health shortage areas in the future. And dental health shortage areas, the dental health shortage areas and recruitment and retention kind of get the short end of the stick. They're really not eligible for many incentives except National Health Service Corps and the State Loan Repayment Program, but we are working on getting dental designations into all of the counties that are in white on this page. So as I said before, to qualify for recruitment and retention incentives, the organizational practice site, it must be located in a HPSA. There has been a little bit of confusion recently around if an administrative building is in a HPSA, if the other locations in the same organization are eligible. And the answer to that question is no. The direct patient services must be provided in a health professional shortage area to qualify for the incentives associated with the designation. There's different incentives associated with different types of designations. So we have a geographic high needs designation and a geographic designation, which qualify organizations for specific incentives, which I'll talk about in a little while. And population designations have a different set of incentives as well. I would also like to note here that medically underserved areas and medically underserved population designations are not eligible for loan repayment incentives. Those types of designations are specifically for establishment of rural health clinics and health centers and for J-1 visa waiver recruitment. So on this page, I have created a chart that shows what the incentives are associated with each HPSA type. One important incentive that I want to point out on this page is the CMS HPSA bonus payment program. That program is only associated with geographic and geographic high needs designations. And that program is very important to critical access hospitals and all organizations just in general. But for critical access hospitals, this bonus payment program will allow you to recoup 10% of all accepted Medicare claims, and those payments come every quarter. So I have later in the presentation some links that you're able to click on that will take you to more information. But I did want to point out that program because it's direct funds right in your pocket that you can use for recruitment and retention of health professions that you need that are specific to your location. Another program that we're working really hard right now with critical access hospitals is the National Health Service Corps. National Health Service Corps is eligible in geographic, population, and facility health professional shortage areas. So that's a really great opportunity with any type of designation. Nurse Corps is the same way, as well as J-1 visa waivers. So those are some really great programs that are associated with the HPSAs. So on this page, I provided some more information about health center programs, the establishment of a rural health clinic program, the HPSA bonus payment program, and the J-1 visa waiver program. So all of these links are clickable, so you can go and learn more information about each of the programs. So the most important topic for today is loan repayment programs as a way to recruit and retain clinicians in your organization. So the first one I'd like to talk about, because it is directly associated with critical access hospitals, is the Nurse Corps Loan Repayment Program. This is the only program that will allow repayment for nurses that are registered nurses, nurse practitioners that are inpatient. All of the other programs are specifically for outpatient ambulatory care in a primary care mental health setting. So the Nurse Corps is actually very easy to be part of. You can send a request to myself or call the Nurse Corps directly to become a eligible critical shortage facility. And basically what that means is you're located in a HPSA and you serve an underserved population. So this is probably the easiest program to, federal program that you can be associated with without doing any additional documentation or going through a site certification process. The Nurse Corps loan repayment allows for 85% of eligible loans to be paid off. The application cycle happens once a year, usually in December, January. And Indiana has traditionally had quite a bit of participation in the Nurse Corps program. So this program is really great for hospitals that are looking to retain any inpatient nursing staff. The next program is the National Health Service Corps program. The National Health Service Corps has a loan repayment program that has 4 different programs, and they are the Indian Health Service Loan Repayment Program, the traditional NHSC Loan Repayment Program, the NHSC Rural Health Loan Repayment, and the NHSC SUD or Substance Use Disorder Loan Repayment Program. The most important thing to note is that you must be a NHSC certified site for your clinicians to be eligible for loan repayment programs. And the site certification is happening right now. And once you become an NHSC site, all of the clinicians that are eligible, so primary care physicians, primary care nurse practitioners, physician assistants, registered nurses, all are eligible for this program. And it offers up to $100,000 in loan repayment funds, which is huge for retaining and recruiting providers right now. So as I said, site certification is happening right now. It is open until May 10th. I'm still hoping for an extension. One thing that we have learned during the site certification is it's actually really difficult for critical access hospitals to become a site. And the state lead for Indiana, through the Division of Regional Operations at HRSA and we have been working to figure out how we can help critical access hospitals become eligible for this program while keeping in line with all the other requirements that are required of you all. So that's something that we're definitely working on. We are more than happy to take a look at your policies that pertain to NHSC, review them. We're happy to have Teams meetings with your team so we can explain the process and talk about if you're eligible or not. Traditionally in Indiana, we have not had great critical access hospital participation. And I think that's because of the difficulty of getting all the policies to align with all the different requirements. So that's something that's been a little bit difficult. We currently do not have any NHSC certified critical access hospital sites in the state. So we have been working really hard to change that. So that critical access hospitals are able to take advantage of the incentives with the NHSC. So another thing that I'd like to talk about is if you have suggestions and you have worked with us before on how we can better align with critical access hospitals, please let us know, because it's important for us to make sure that we're taking feedback back to the federal level to make sure that we have policies in place that make it possible for critical access hospitals to participate in the NHSC and site certifications. The organization type requirements for NHSC sites must be an outpatient facility unless you're a critical access hospital. If you're a critical access hospital, you can apply. You must have at least one outpatient facility associated with your site. All of the specific requirements of the NHSC include the emergency department, and which is also a little bit difficult because the ED works a little bit differently than an outpatient facility. So that's something we are happy to work through with you. Another important thing about the NHSC is that one of the most specific requirements includes serving all patients regardless of their ability to pay. And that is a little bit difficult when we're talking about ED services. So we're happy to talk through all of those different requirements. So I know this chart is a little bit small, but I'm happy to send it out to anyone who would like it. This is loan repayment for eligible professions and what loan repayment programs those eligible professions can take advantage of. As you can see, there are lots of programs and lots of different professions that can take advantage of the programs. One thing that is kind of coming down the pike from HRSA that I'm really excited about are the maternal health designations. And we will eventually be able to offer loan repayment and certain incentives, which HRSA has not told us about yet, but those will be specifically for OB-GYN and certified nurse midwives. So that's something exciting that's kind of coming down the pike. Another thing I wanted to mention is with the state loan repayment, pharmacists are eligible to participate in that program. So if you have any pharmacists in your organization that would like to take advantage of loan repayment, I will give you some contact information in the next couple slides to help them apply for the state loan repayment program. So the Indiana State Loan Repayment Program is a program that is administered right here at the Indiana Department of Health through the Office of Primary Care. This program provides loan repayment for federal student loans. It encourages full-time delivery in healthcare shortage areas. This program provides incentives for psychiatrists, alcohol and substance use counselors, and practitioners in related disciplines, including primary care, to practice in specific regions of Indiana that are experiencing high numbers of opioid deaths. Priority areas are identified as healthcare needs in the state change. So when we first started this program, we were seeing really high rates of opioid deaths. So we looked at that data and we chose 10 counties that had the highest opioid rate deaths in the state, many of those being rural. And we focused our efforts in those areas. I included a link here so you can find out more information about the loan repayment program. We currently have 90 recipients of the state loan repayment program. In this map, the blue counties are rural, as defined by OMB. The green dots are mental health and the orange dots are primary care. So half of our recipients were actually practicing in rural areas, while the other half were practicing in areas considered to be urban. So we really tried hard to spread that equally between the two types of rurality. And we were pretty close on primary care and mental health recipients as well, which was really exciting because historically we have not had tons of mental health recipients, so that was really exciting for us. So we have many of the same eligible professions as the NHSC. The state loan repayment program is meant to complement the NHSC and act as a safety net for those providers that don't either qualify for NHSC or the site is not eligible to be certified. This program kind of catches those sites and providers that fall through from NHSC. The disciplines that are eligible are physicians that fall into the primary care realm, general practice dentists, primary care nurse practitioners and physician assistants, certified nurse midwives, psychologists, dental hygienists, psychiatric nurse specialists, counselors, marriage family therapists, registered nurses, and alcohol and substance abuse counselors that are either licensed in the state of Indiana or have a master's degree with the alcohol and substance abuse certification like a CAH. So these are the eligible professions right now. We did submit an application for another 4 years of funding for up to $1 million per year without a state match. So we're really hoping that we get those funds so we can create an even bigger safety net. I will stop here and answer any questions that you might have. I appreciate being able to be here today, and excited to work with anyone who would like to take advantage of these programs.
So Lacy, we do have a couple of questions here in the chat. So on that spreadsheet, that's part of your presentation, correct? So if they get the PowerPoint, they'll automatically get that spreadsheet, correct? Perfect.
Yep.
Okay. And then we also had a question about what type of repayment programs might be out there for physical therapists.
Unfortunately, that's actually a question we get quite a bit. Physical therapists don't fall into any of the categories in federal loan repayment that are associated with the health professional shortage area designations. But we don't have anything for physical therapists right now. I'm always on the lookout for loan repayment programs for other professions that don't fall into the federal or state programs. So if that's anything I find out, I will make sure that Joyce and Becky know about those.
Perfect. And then also, there is too a website, correct, where people can go and post their positions they have open to invite people to roll, and vice versa. Those that are wanting to come to roll are out there posting their resumes, correct? And if so, would you mind sharing that?
Yeah, it is called the Health Workforce Connector, and it's where different organizations can post openings. It will tell how many openings are available and for what professions. A lot of FQHCs and rural health clinics use it, especially if they're NHSC certified. So I will put that link in the chat.
Perfect. And while Lacy's doing that, I'll also share with the audience that I obviously during kind of this peak time received many invites that I disseminate out to you about the different webinars that the federal level is hosting, like on the nurse repayment program and HRSA designations and so forth. If you are not receiving those types of webinar invites from me, I'm going to put my email in the chat. So please let me know if you aren't getting those and would like to, and I'll be more than happy to add you to my listserv. And then one other question, Lacy. So if a hospital is interested in kind of pursuing this, kind of where do they start and when should they start to have that conversation?
Sure. So the sooner the better. It does not hurt anything to start very early. We always do site certifications in the spring for new sites or sites that have been NHSC certified and have expired. And then there's also a recertification time in the fall. So it's never too early to get started. The first step is to reach out to me. We will set up a Teams meeting. Our state lead, Salita, and I have been doing technical assistance through Teams. And if she's not available, I usually take the meeting and help as much as possible. And then we try to get together. We basically will review all of the documentation beforehand and make suggestions. It's really nice because when Salita reviews it, and she gives it like the stamp of approval, then when we review those applications, we already know that they've, received her approval, and it goes much quicker. But it's never too early to start. We are happy to review policies and provide feedback and suggestions on anything that's NHSC related. So you can email those to us. We can hop on a Teams or a phone call. But really, it's never too early to start. And just a quick email or phone call to me will get the process started.
Perfect. Thank you. Okay, yes, that was answered about a copy of the slide. So I do not see any further questions. Does anybody else on the panel have any other questions? Or is there any, do we want to, are any hands raised that we need to unmute anyone?
I currently
good
no
to
raised
go?
hands. Correct.
Okay. Any other questions?
I don't see any, Joyce.
Okay, well, thank you. Thank you so much, Lacy. Appreciate so much you taking time out
Yes.
to speak to this. I know I keep you busy because we're bringing it up at every hospital visit. What are you doing about this? And trying to initiate those conversations, which we're happy to have. Even, you know, Lacy has bends over backwards just to help further educate people. So if you're just not really sure, and I know this is a lot of information, I've heard it 20 million times. I'm always bending Lacy's ear about it. I still don't feel like I quite have my arms around it, but Lacy does. And so I take great comfort in that. But anyway, if you just kind of want to walk through this and just have a lot of questions, trying to determine if it's a good fit for you, please just reach out to Lacy, and she's more than happy to take your own personal situation and see what might be the best fit for you.
Yeah.
So again, thank you, Lacy. I appreciate it.
Yes, thank you so much to IRHA for having me. And if anyone needs anything, I'm here and happy to help.
Thank you.
Thank you.
So Becky, do you want to, I know we're a few minutes early, which yay, but do you want me to go ahead and start with the next group, or?
Actually, we have people that are joining specifically at the time to hear their presentation. So at this time, though, everyone's wellness is very important to the Critical Access Hospital Partner Team. And at this time, Brent Anderson, practice coach with the Chronic Disease, Primary Care, and Rural Health, is going to take us through an exercise, and then we will resume with the next presentation right at 11:15. I hate to start early since there are some joining just to hear this presentation specifically.
Yes, so sorry. That's my error in looking at the agenda. So yes.
No problem. No problem. Go ahead, Brent.
Yeah, can you guys hear me?
Yes.
Thank you. Thank you, Becky. Thank you, Joyce and Lacy. Great job. So thank you guys much. So I was asked to share MindBody Medicine skills. I'm finishing up my certification through the Center for MindBody Medicine, working on trauma, doing trauma work, transforming trauma and teaching skills, self-care skills to heal from trauma and to help manage stress better. So what I want to do today is share with you awareness of breath and exercise that really is deep breathing, and just begin by 2 to 5 minute a brief discussion, and then just practicing being aware of breath, and just to begin, just to share with you a few thoughts, and then we'll actually do the breathing together. Relaxed moment to moment awareness is the most basic of mind body medicine techniques, and learning to notice your breath, the breath patterns, and to change it from a tension producing to a relaxed one is a simple and crucial mind-body medicine technique. It's the fundamental of all the other techniques we teach. And breath, as we all know, is central to life. We can only go for a minute or two without having breath. Breath brings us oxygen, and it also, along with food, gives us the fuel we need to produce energy. It affects the way we think, perform, and feel. So if you would, this exercise is awareness of breath, and just for a couple of minutes, we're going to breathe together. And so if you would sit comfortably, your eyes can be closed, you can put your feet flat on the floor, or your eyes can just be in a relaxed, soft position. And begin to notice your breath, breathing in through the nose, and then exhaling slowly through the mouth. And what we're doing is focusing in on the breath. And just notice as you breathe in deeply through the nose, and you exhale slowly, we're beginning to reset and relax and put our bodies in a homeostatic state. So just spend the next minute or so focusing in on the breath. You may have thoughts that come in, let them in and let them out, and just focus back in on the breath. Breathing in through the nose. And exhaling slowly through the mouth. You may be feeling tense, so notice where that tension is and begin to release it. And as you begin to breathe in through the nose and out through the mouth, let that tension out with that. So let's do it for about another 30 seconds or so. And notice your thoughts, your feelings, and sensations, and name them. Are you anxious? Are you relaxed? Name them and bring your attention back to the breath and focus in on the breath coming in through the nose and then exhaling slowly through the mouth. And let's take a couple more breaths together. Breathing in through the nose and exhaling slowly through the mouth. And let's take one last deep breath in through the nose. And then release, slowly exhaling through the mouth. And when you're ready, you can open your eyes and come back into the room and just notice how you might feel a little more relaxed. And the more that you practice breathing and using that technique, breathing properly in through the nose and exhaling slowly, deep breathing, you'll enjoy the benefits of it. So I think we've got another break scheduled today, and we'll get a little more time with this, but that's the intro to it. Just being aware of your breath and practicing breathing in through your nose deeply and exhaling through your mouth. Becky?
Thank you so much, Brent. Very helpful, and it just helps everyone center. So appreciate your time. We'll begin promptly at 11:15 again. Please stay connected. I know we'll be having a few others join us for the next presentation, which is community paramedicine.